Hi, everyone. Hello. Happy Thursday. Happy Thursday, 5 p.m. Pacific Standard Time. I go live at 5 every Thursday, 5 p.m. Pacific Standard Time. My name is Julie McFadden. I'm a hospice nurse and death and dying educator, and I'm here to say hello. All of my early birds are here. I love when it's like, let's see, Chris is here, Tom is here, Crystal's here, Jennifer's here, Megan, Darlene, Steph, Kent, Mary, Epi, Sally, Teresa. I recognize everyone's name. Welcome, you guys. Come on in. Hey, Bob. Hey, Magna. Oh my gosh, Magna from Romania. We are worldwide. I love it. What time is it in Romania? Question. Victoria, Hopkinson. I'm probably saying that right. Nancy, Jesse. Welcome, guys. Show each other some love. TBR, TRB. Did you guys see how I did the letters wrong? Because I'm dyslexic. You know what? It keeps things, what's the word? It keeps things exciting. Jean, Amy, the real Pumpkin J. Your guys' names are hilarious. Welcome, guys. Come on in. Let me know if this is your first time here. It's 3 a.m. in Romania. Girl, get some sleep. I'm just kidding. We're happy to, you know what? Maybe my voice will slowly put you to sleep. Gail's here. Gail, I haven't seen you. I have seen your name in a while. If I say that, it's only because it's a me thing, not you thing. I don't remember anything. Sally. Sally's here from the UK and it's 1 a.m. there. Oh my gosh. Thank you. Iris is from El Salvador. Welcome, Iris. Lisa from Florida. It's Pumpkin Jay's first time. Thank you, Michael. Hi from Philly, Michigan. Oh, my voice just cracked. Astrid. That's a great name. You're dying from systematic lupus. What's your experience with those dying from that? You know, I actually have Astrid, only to be just completely truthful, I do not have experience with anyone dying from lupus. I do not. I'm so sorry. Please stick around just for the community and ask other questions if you wish. And maybe people in the chat will have some experience, but I have never have had a patient with that. Neela from Portugal is here. Jackie, I hope I'm saying your name right. Welcome. Sandra from SoCal. Me too, Sandra. I'm in LA. How does one contact you about a collab? Jimmy, you can contact me via email, hospicenursejulie@gmail.com. Oh, hey, you guys. Actually, now that everyone's here, this is not an ad, okay? Even though it's going to sound like one. And I wish I could move my camera. But I don't know if you guys saw my last video, but in my last video, there was an ad for me showing you about electronic, and I'm keep looking this way because that's where the chair is. This electronic chair. And the electronic chair lays you fully flat, lays just your feet up, lays your back just down, helps you stand up. There's a heat mode, so it turns on and it heats up for you. There's a massage mode, which I don't think is that great actually. It's just like a vibrating thing. But usually these chairs cost around, that's my YouTube live warning me to go on YouTube live. My alarm. Usually these chairs cost around $1,500 to $2,000. Right now, it is $350. And if you use my little code, it's $300. It's $300. It's like the best deal on planet Earth. So if you're looking for a chair like that or anyone you know, please tell them. You go to the last video I posted, look in the description. In the description, you'll see a link for, I think it's called Flexi Spot. I should try to find it right now. Again, they did technically pay me for this ad, but no one ever looks at it because they always think if it's an ad, then it's like not real. But I'm telling you, it's like the deal of a lifetime, and it's a really good chair. I have one here in my living room right now. It's an amazing chair for $350. Plus, you get $50 off if you use my little code that's in the video. So if you need something like that, please, please, please get it now. Okay. Now I'm going to get to questions. If you're new here, welcome everybody. I'm Hospice Nurse Julie. In case you don't know, I go through questions. Please try to write your questions in all caps, specifically if I keep missing them. If I start looking down, it's because I'm looking at the chat. If I'm looking up, it's because I'm looking at you guys. Let's quickly start. Okay, I'm going to read some questions, and then I kind of want to do a big talk question. I'm scared of dying and I have CHF. A psychic told my father that I would be afraid of death. Michelle. Who is this psychic? So, Michelle, if it helps, it's super normal. It's super normal to be afraid of death. I always talk about this. Nothing is wrong with having fear around death. My book is called Nothing to Fear, but in the book, I talk about how it's not nothing to fear, it's normal to fear. And the more you express it, the more you talk about it, usually the better it goes. So say the truth. You can be afraid. I am not really even afraid of death. And if I got diagnosed with something terminal tomorrow, I would have intermittent fear because it's just the fear of the unknown. So just keep talking about it. If it really is affecting your life, like in a crippling way, of course, therapy is always good. Talking to a therapist is amazing. But generally speaking, it's very, very normal. And very few people are literally like minutes before death being like, no, they're usually unconscious. Our body takes care of us. We slowly shut down. And over that time and process, our body begins to let go. So watch my videos. You probably already do, but continue to watch them, and it should be It should be somewhat helpful. And you are very, very normal. And just keep talking about it. My wife likely has Lewy body dementia. Share with us about the progression and eventual ending of someone with this horrible condition. So, Michael, I can't really share with you how it'll progress fully. Because my expertise is in end of life dementia. So I have many, many videos about this, Michael. Go to my page, Hospice Nurse Julie. I'll still talk about it here, but make sure you go to my page and look for any video that says dementia. Don't worry if it's Lewy body or not. Okay. That's the way when people are end of life dementia, they almost all look the same, which is usually fully bedbound. So bedbound, nonverbal, incontinent, and need like a max assist for all ADLs, meaning to be fed, to change, right? And it's a very peaceful death once you're there, but it's very, very hard because you do have to fully care for this person. I would say now get into place what she would want, what she wouldn't want. Like, I would never, now this is just a suggestion, this is not medical advice, but I would never suggest someone with dementia getting a feeding tube. They will not starve to death. Their body will slowly shut down. And it can be a very peaceful death. Just the process of it all is not very peaceful. And it's just really, really hard on the person caring for them. But I would also, Michael, go look at any of my videos that say dementia on the front of them. They're all labeled. My mom has stage 4 cancer. Your videos have helped me so much. Oh, thank you, Jackie. Thank you. Okay, my cat was just diagnosed with chronic renal failure. Is your video you posted yesterday in relevance to our feline friends as well? Austin, I do believe so. Yes, I do believe so. I would talk to your vet, but I do believe so. Have you ever had a DNR that changed? I had a man with Parkinson's who had DNR, was very nervous, and then they changed to full code. I think I've had patients go back and forth, yes, but I've never had to give CPR on one of my hospice patients. Hey, Julie, father-in-law is in final stages of kidney disease. Roughly how long does he have? Also liver disease, heart disease. I'm thinking 2 months tops. So, Rick, with just that little of information, I would not be able to give an accurate diagnosis of how long someone has. I would talk to his doctors about that. I would need to know final stage, I would need to know like certain numbers. I would need to know if he's making urine, how much urine. I would need to know how advanced his liver disease is, his heart disease is. I would need to know so many things for me to actually answer that. I don't say that in a mean way or like in a like, so I'm not going to answer. I just want people to understand that, I want to be a real help for you guys. And I don't think it would be very helpful for me to like, I just don't want to be someone who's just like spouting off things that um aren't necessarily true. You'd have to, it would be like unfair of me as a healthcare worker to try to say how long someone has without knowing much, much more information. But I would say if people are still walking around, talking, eating, lucid, they have, like you said, months. If they're not really eating and they're sleeping more than they are awake, they probably are, in the 1 month range or something. But as long as someone's making urine with kidney disease, they can live for a longer period of time. It's when people stop making urine, like zero urine being made, then they will die within 7 to 10 days. So that should clue you into something. Now, if he's still on dialysis, that's a different story. That's what I mean by like needing to know details. I would talk with his doctor. They would be able to help you a little more. I recommended the book. It really helped me. Unfortunately, TV portraying death is very difficult. Yes, Sally. Yep. Have you ever had an intense emotional release helping out a hospice patient where you couldn't perform the job? As in, does the patient find it weird when a nurse cries? I have not had that happen. And I would go as far to say as hospice nurses should not do that. If they cannot perform their job and their emotions are getting in the way of their job, I would say they shouldn't do it. Or they need to learn how to have boundaries or protect themselves so that's not happening. Because what happens is people, when they're doing that, it's taking away from the patient care. And then the patient feels like maybe they have to comfort the nurse, or the family feels like they have to comfort their nurse. It's one thing to have somewhat of an emotional response, right? Maybe teary eyes, but it shouldn't impede you being able to do your job. And if it is, I do think that's a problem. But crying is okay. It just shouldn't be like, because it's not about you. And I'm not saying you, the person who asked the question. I'm saying, as a nurse, it is not about you. You are there to be the pillar of helping, right? So, as a hospice nurse, you need good boundaries and I'd say good emotional stability. Not that like crying is wrong, right? It's not wrong. It's okay to cry. It's just you need to find the time and place and you can't let it affect your job, your work. My mom just died 12 days ago. I'm sorry, Stacy. I have a question. She started off with a UTI, then turned to sepsis. Then they found an aneurysm and it grew bigger with 50% with bigger than a 50-cent piece. What actually killed her off? Again, Stacy, I'm so sorry. You would have to ask the people who are working with her. There are a bunch of things that could have done it. So did the aneurysm rupt? Was it the sepsis? It's probably a mixture of all of them, but you'd have to talk with the people who took care of her. I'm just going through the questions. Bear with me here. My opinion on assisted death for terminal illness is that I am okay with it. I have many videos about this, and I have witnessed people taking the end of life medication. It is legal in the US, and I hear that it's going through Parliament, I believe, in the UK. I believe in ghost-ish. I guess I believe in ghosts, yeah. But I'm going like this because, like, I'm kind of scares me. When my dad passed, his face flinched like it was painful. I never witnessed that before. Oh, according to Heather, a lot of times there are just twitches that happen right before death and things that start to relax. So the face makes certain faces. I don't know if it was pain or not. I mean, I guess I can't say for sure, but generally speaking, if he looked really relaxed the whole time and then just at the very end he flinched, I wouldn't say that might not have been pain. That could have just been a muscle reaction and twitching in the face, which can happen because of like chemical imbalances and different things that are like high in the blood chemistry that can make you twitch. I had a patient that has decided not to take any cancer treatments. They might only want something for pain. Oh, have you ever had a patient that has decided not to take any cancer treatments? They might only want something for pain. Yes, we've had that. A lot of times though, people can't just come onto hospice just because they decide not to do treatment. You have to still have less than 6 months to live and things to manage. So they might be on palliative care first and then be on hospice. But yes, people can definitely do that. My suggestion for people who want to do that would be if there is a standard of practice, let's say you get a very common cancer that people generally live from or can have extended life with certain types of treatment. I would still, again, they still have the right to do whatever they want, but I would always recommend people do the standard thing. Like there's like typical type of breast cancer. You get the lump removed, you have chemo, you have radiation, then you're done, or lump removed, then chemo, no radiation, depending on what you want to do. But I would still recommend doing that because a lot of times not doing it will cause more pain and more issues because you never did the standard thing. You let the tumor grow, so now it's impeding some kind of vessel, which hurts and hurts with and stops blood flow. So there's some issues that can happen because you just never did anything. So sometimes if there's a standard of practice, especially if it's like well known to really help treat symptoms of a certain type of cancer, I would always try to recommend doing that first before you just come onto hospice. But again, everyone has the right to do whatever they want. Hospice nurse said my 88-year-old mom would die from her CHF on March 1st. We are now almost to May, and all family planned a cruise over Christmas. We feel horrible for this. Is it normal to stay alive? Sometimes. That's why it's really hard to really say, like, when for sure someone's going to die, because people will sometimes have their own timeline. It's so hard. I'm so sorry. Hi, Julie. When you saw the angel at the bed of the woman, was it just head and shoulders or was it white and luminous? Not white, not luminous. It was cream and it was not just head and shoulders. It was like head, shoulders, and then the whole body went all the way down to the ground. I just didn't see all the way down to the ground, but it was huge. It was as wide as a car. Picture a car up on its rear end. I mean, it didn't obviously didn't look like a car, but like that's how wide and how big and tall it was. If that makes sense. Thank you, Charlotte, for saying thank you. You make me want to be a better nurse every day. Charlotte, really? Oh my gosh, thank you. That really means a lot to me. Bear Mom says, I'm a sepsis survivor and I know I was intubated multiple times, but there's 3 weeks in the ICU. I have no memory. Double pneumonia, 100% oxygen. I wonder if I was put in a medically induced coma. You probably were put into a medically induced coma, I would bet. A lot of times if someone is intubated, specifically if they're intubated on a breathing machine and the breathing machine's doing stuff for them, like breathing for them, you have to be sedated. Otherwise, it actually feels like you can't breathe, even though something's breathing for you. Kevin says, I only fear leaving my loved ones behind. Yes, many, many, many people say that. And that's okay to have that feeling. Let's see here. I hope you answer, please. When my dad passed, his face flinched like, oh, shoot. Heather, I think I did answer that. I think, hopefully you heard my answer. I said, I think it was likely probably not really pain. It was probably a physical reaction, like a twitch that happens because of certain blood chemistries changing. Does severe childhood trauma impact dying peacefully? I've worked for over a decade in therapy, and and I am a lifelong work in progress on letting go. Aside from asking hospice and family to keep me, I feel like childhood trauma could affect the dying process, but I think the fact that you're even willing to like bring this up and say anything about childhood trauma, you are already a step ahead of most people. So I think if anyone is willing, as long as you're like willing to talk about talk about what your experience in the moment is, you are seriously so much further ahead than like the majority of the population. The fact that 248 of you guys are in a live chat room talking about end of life, you're already miles and miles and miles ahead of most people as far as like even understanding that you're going to die. I think people underestimate how many people live in denial. So please find that. I hope that seems encouraging to you. Hi, Nurse Julie. Why is it that even if you have regional pain syndrome like I do, along with disability, cancer in my backbone, whatever, but no doctor wants to give me any pain treatment at all? Oh boy. I don't have a good answer for that. I don't have a good answer for that. It's really, really hard and sad and unfortunate. I don't have a good answer. Pain medication is, doctors and pharmaceutical companies started this pain epidemic that we have in this country now of people being drug addicts because of it. And now and so it's their fault it started, and now it's our fault. And now we're having the repercussions of that. People who really need pain medicine. Why did injection for morphine go to my wife's neck? That does sound strange. Was she in the hospital? And did she have a line? Usually they have lines in their neck. That's a big IV line, and they put medication through there. Um, Blue Rose Lady says, my mom in the last hours of her death sat up and she stared right at me with a horror like look of Jesus on the cross. It scared me. She was terrified or in pain, just trying to tell me something. So, of course, I wasn't there. So I'm so sorry that I can't say, I guess, quote unquote, for sure what was going on. But I do think a lot of things that happen at the end of life, even though they seem super scary and they seem like she wasn't okay or something was really, really wrong. And I could see how you would think that, right? And I can't say for sure that wasn't going on. Maybe it was. But what I can say is at the end of life, most people are not fully there. Like the mom that you know and love, maybe, is not like fully there. There's a lot going on in the body to like let go and release. There's a lot the person's processing physically, mentally, emotionally, spiritually, right? There's a lot going on, which can cause the person to do a bunch of strange things that don't necessarily indicate pain. And I truly believe, even if the person is kind of quote unquote struggling, I don't know if they're really fully like, in there, right? And just unable to tell you what's going on. It's like they're not fully there. So it's like half of their body biologically, and there could be a lot of confusion going on, a lot of agitation. It's not like they're perfectly in their right mind and all of this is happening. So again, I wasn't there, so I can't say for sure, but I just do want to normalize some of the strange things that can be hard at the end of life. But it doesn't necessarily mean that like they were super, super struggling, or that they were terrified, or that they were in tons of pain. It doesn't necessarily mean that. And I'm not just saying that to you to make you feel better. I would have had to been there to be able to tell you more, I guess, but generally that's me saying it in a general way. Okay. Bear with me, guys. If I haven't answered your question yet and you're like, shoot, I want you to answer my question, just keep asking it in all caps if you can. Um, Thank you to everyone saying thank you. I'm sorry I'm not reading everything aloud. I am reading most of the comments, so I am seeing them. And thank you so much for saying all these wonderful things and supporting me and the group. Um, Rubber Toe says, when I'm near the end of death, I want to have morphine every 5 minutes for pain. And I just want to clear everything up, you guys. Remember, death does not actually indicate pain. Just because you're dying does not mean you're going to be in pain. Diseases you're dying from can be painful, but many, many people die from many, many different diseases and they do not have pain. And the actively dying phase, the things you're witnessing there are mostly biological and happening purposefully for the body to shut down and the person's not in pain or struggling. We're just not used to seeing it, so we associate it with the person struggling. And that's hence why I started this channel, so I could educate. Oh, this is a good one, Marilyn. I hope you're here. As my husband was dying, he was very still, but every time he exhaled, he would moan very loud and did this until I'm guessing the end. That was likely him doing some like self-soothing mechanism or even just like a rhythmic whenever it's rhythmic, it's usually just the person like the person like just like that. It's like a biological thing the person's doing, not necessarily because they're having pain or anything, but because it's like a self-soothing mechanism. Thank you, Amy. And it's very normal to hear that, especially if it's rhythmic. Or like it's very normal. It is true that hearing is the last to go. Someone just gave me money. Austin, thank you. Thank you for answering my question. I respectfully bow to the mystery and death. Weirdly enough, my cat Trixie keeps laying beneath a painting of a Pied Piper. Oh, wow. Remember the video about Gene Hackman? I almost cried watching the video. I know, Gene Hackman and his wife. How unfortunate. Do you think dying people know they are dying and feel like their soul is slowly fading away? I don't know, but I do feel like when a dying person is still alive and conscious, I do think they know they're dying. Because most of the time when I ask people who are on hospice, I say, "How do you feel? What do you think's happening to your body?" Almost all of them say, "I think I'm dying." So I think people do know. And as far as like what's happening when they're unconscious, I do feel like something spiritual and emotional is going on, but that's just my belief. So I never really spread it around because like it's just my belief. It doesn't matter. Everyone has their own beliefs. I know I miss seeing my dog Roy. It's technically not my dog. It was Rich's dog, but Rich is kind enough to let me see Roy basically whenever I want. So I have seen Roy, just not on my lives. Thank you, Capita. I'm sure I'm saying your name wrong, but thank you. Welcome everybody. Come on in. Just see, I'm hospice nurse Julie. In case you don't know, I go live at 5 every Thursday. I try to answer as many questions as I can about death and dying, about hospice, about sobriety. If you have questions about sobriety, I'll answer really anything you ask for the most part. And I try to get to as many different people as possible to answer questions. And if you want to, try to write them in all caps so I can see it better, but you don't have to. Thank you to everyone saying thank you. Oh, you helped me so much. I requested a referral for hospice today. Finally, no more chemo. I can take a deep breath and just live. Oh, Nicole Dingle. Am I saying that right? Thank you so much. It seriously means the world to me. Before my dad passed, he asked me, "How did Pop do it?" Pop was my grandfather, his dad. Oh, Victoria. Wow. Thank you, Tom, for answering questions. Thank you for someone who Oma said your book helped my family. Thank you. Thank you. Thank you. Thank you. Thank you. Yes, Rich and I did break up. Roy is the dog. And Roy went with his dad, Rich. I do not really feel depressed because of my job. Because I was an ICU nurse for so long, and that made me feel really depressed and sad. Because I felt like it was like, man, if we're gonna die, there has to be a better way to do it. So I don't feel super sad about people dying on hospice. I feel like there's a worse possible outcome. I have a friend very sick with cancer. At what point would he be eligible for palliative care or hospice? Palliative care probably right away if he has a lot of symptoms. Palliative care is just for symptom management. Hospice would be once he has decided he doesn't want to do treatment anymore, and he has 6 months left to live. A doctor could tell him that. Hopefully, he has good doctors around him to help him understand his disease progression. Amy Mick, I didn't see the stuff you wrote before what you're writing now. Corey, I'm glad you're here. Come back every Thursday if you need questions answered. Thank you, Victoria. Okay, you guys, how about this? All 290 of you guys. Well, first off, all 290 of you guys, if you need my book, it's called Nothing to Fear. It's out now. It's a New York Times bestseller, thanks to most of you. And my journal is out for pre-order now. So if you order my book, you can also order my journal. Same name, just Nothing to Fear journal. Do you think people know when they're going to die? Much like cats, I do think so. Yes. Is more I have your book in my cart. Yay! Hey, Jewel teacher. Nice to see you. I'm close to needing hospice, but I'm scared to take that step. How do people do it? When you're ready, you're ready. If you're not ready yet, don't do it. If you're not ready yet, don't do it. You can still talk about it. You can still plan end of life. I always talk about how everyone has an end of life journey. Everyone, we all will. Some of us are going to know ours, some of us won't. And it's just a matter of taking steps to know what you want your end of life journey to be. And when you're ready, you will. I mean, to me, hospice is not about dying. I really mean it. It's not like, oh, you go on hospice, now you're going to die. I mean, hospice is about living. Hospice is about living out the rest of your life. That is what it's about. That is what it's about. So if you look at it that way, it might feel a little less scary. Are there extra items that Medicare, Medicaid doesn't cover that'd be helpful to support someone on hospice? They do not cover caregivers, like day-to-day caregivers. So that's like the biggest expense is someone to care for you, change you, take care of you, give you medications. Hospice doesn't cover that. Medicaid sometimes does, but most people can't get on Medicaid. But Medicare does not. So that's the biggest expense, I think. Do you believe you'll move back to the East Coast? I bet someday. Mhm. My sister-in-law is stage 4 inoperable lung cancer in remission. Any knowledge you can share? How long could this go on? Oh, Lori, I'm so sorry. I'm so glad you're here. But honestly, my forte is not like how long can someone live with cancer? What type of cancer? How does everything progress? Mine is like once they're on hospice, this is what you can expect. So I would need to know a little bit more about what type of lung cancer it is, how long they have had it, is it has it metastasized, things like that. So it's really hard for me to know. There's too many questions there. If you're dying and you're in the hospital at the time and you want your pet with you, does the hospital allow it? I bet some hospitals would, some hospitals wouldn't. So it depends on like who's working that day. Um, and like their policies, but some would. Thank you. Someone with the name Aeon. Of course, I don't know how to pronounce anything, but thank you. Is it true that when a loved one's pass, they wait until their loved ones leave to go home to pass? Both my parents did that. Victoria, yes, that can be true. It's not always true, but it can be true. People do sometimes wait for everyone to leave. Pizza or lasagna? Depends on the day. Right now, I'd say pizza, but I definitely love lasagna too. Thank you, Dara. Yes, I actually muted that person for a while. Have you dealt with rude and aggressive people on hospice? Yes. Yes, people are definitely rude and aggressive on hospice. Not everyone and not all the time, but definitely I have. Can you tell me why my dad was moving erratically, even violently when he was actively dying? It could have been terminal agitation. If the nurses and doctors that you were with said it was okay, then I guess it would be okay. There could be many, 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 many reasons why. And sometimes we'll never know why. Sometimes it's, high levels of calcium or sodium or ammonia levels. If the liver's kind of not clearing ammonia levels out, sometimes it's just labeled as terminal agitation because we don't know why. And we'd have to medicate heavily to get them to keep themselves safe. But a lot of hospice stuff is like we don't know. We don't know. And that's really hard for people to hear that. I get it. I get it. I would want to know too, but sometimes we just don't know. I would have to have been there to see whether we should medicate or not and like medicate heavily. And sometimes it's like they're making all these movements, we medicate, they're still making the movements, we medicate more, they're still making the movements, we medicate more, they're still making the movements. We medicate, they finally stop, they finally relax, but between here and here, the families had to deal with that stress. So it's hard. Oh, thank you, Brandon. Hi, Julie. First time live. I'm a Gen Xer nursing student graduating in 2 years. Woohoo! I know hospice is for me. Is it better to do hospice RN residency or go straight into hospice job that trains new grads? I didn't do that. I didn't go straight into hospice, so it's hard for me to say. I would say if you really know you want to do hospice, then just go to a hospice company that will train you or work in a hospice like facility, not going into hospice homes. Work in the facility first that is only hospice patients. That will give you all the training you need. If not, then do 2 years in the hospital somewhere. I would suggest ICU, even though it was torturing, you'd learn a lot, and then go into hospice. But if you want to for sure just go right into hospice, just go into like a hospice home or a hospice facility where they do inpatient hospice. You'll learn a lot there. You'll learn a lot there. Hold on one second, you guys. There we go. I blocked Mark Lee. Unfortunately, Mark Lee is probably going to come back under a different name. Thank you, Brandon, and good luck. I'm so excited for you no matter what you do. Unfortunately, I have a feeling that Mark Lee is just going to keep changing his name and coming in here. I guess I could just answer him and say, no, I'm not going to date you. I recommend getting a durable power of attorney for both health and finances. It's not exclusively for end of life. Yes. Have you ever dreamed of patients thanking you for caring for them or showing you the other side? No, I wish I had though. I did have one patient before he died show me what it was like to die. That was my only shared death experience, which I do have a video about. Just go look at any of my videos on my page that say like why I'm not afraid to die or my shared death experience. It'll tell you that. But I have not had any of them come back from um like into my dreams. Have you ever discussed your experience with your colleagues? Do they have the same? Do they have the same, or is it only you? I think most. I mean, all of my colleagues are amazing. I think a lot of people in hospice are into hospice. So yes, they are great. Do you meet patients who do not want to acknowledge they are terminally ill? Yes, and that's rough. But I do have patients. I really try really hard to get them to talk in a very non-aggressive way, but just like, you learn little tips and tricks on how to get people to talk. But sometimes it doesn't matter. People just don't want to. And I will say I've learned from them that I don't want to be that person. And the more you're able to talk about it, the better you live and the more peaceful you die. Because guess what? Just because you don't talk about it doesn't mean it's not going to happen. You will still die. But guess what? Also, people who have lived their whole life not talking about anything, not having an emotional awareness or maturity, they will die like that unless they choose to change, which it can be hard, right? My mother has been diagnosed with vascular dementia 2018, also has rare. They stopped treatment for a year ago. Does the death look like for leukemia? Um, you know, I the death for any type of leukemia, not just that rare type, because I'm not actually familiar with that type, never stands out to me. I'm sorry, my house just got like super hot. Is it my house or is it my hormones? My hormones. So death by, and forgive me for saying death by leukemia, it sounds bad. If it doesn't stick out to me, that usually means there's not tons of symptoms. So, like any kind of blood cancer never sticks out to me. Like I don't remember patients with blood cancer, so I just which tells me it's probably peaceful because if it wasn't, I would remember. I would remember. I hope that helps a little bit. Thank you to everybody saying thank you. How do you handle those who are ashamed for the need for help? It takes time. There are so many people who do not want to ask for help and they refuse. And we just keep working with them over and over and over again until eventually they usually ease up a bit. Hoyt zone. I don't know. I tried to explain to you before about the morphine in the neck. I said I don't know why we would never give shots in the neck. I don't know. We sometimes have lines, so there are IV central lines that go into the neck, and they give medication through those lines. Now those lines go directly into the bloodstream, so that could be what it is, but we would never like take I mean, that's a very dated thing to have like a shot that goes like directly into the neck. But I wasn't there, so it'd be very hard for me to know. You should talk to people who were there doing it. Pancreatic cancer can be a painful cancer. Um and my only suggestion there is that like if someone was having a lot of pain on hospice, the hospice company needed to be trying to manage it the best they can. But sometimes what happens is it's like they have pain, we give medicine, the pain goes away. The medicine wears off. They have pain again, take medicine, pain goes away. So like there is a lot of like significant relief, but then because it doesn't stay and they still have episodes of pain, it's hard to only focus on, well, they were in pain a lot. So there will be chunks of time with pain, but hopefully those periods of time are cut shorter and shorter through medication. But it's not a perfect science. It's not a perfect science. It's definitely hard. Thank you to everyone saying thank you. Do you have experience with someone dying from pulmonary edema? Not tons, Grant. Only in the ICU, and we did a lot of stuff to keep them alive, so it's hard. Oh boy, now Serena Morales wants to date me too. I believe someone keeps coming on just changing my name. Maybe you'll stop if I tell you no, I won't date you. I mean, I just broke up with someone, you guys. You think I'm going to date someone right away? What kind of girl would I be? So no, I'm not dating anyone, male or female. So you can stop asking. Thank you. Okay. Purple Diamond, I'm actually not sure how to answer you. I would talk to his doctor. Or I don't know why I said his. Oh, you said his. Okay, good. and it won't get better. What does it mean? Okay, sorry. Okay, what does it mean when the GFR goes from 16 to 13, 40 in between? It probably just means his kidneys are failing and they're not going to get better. But I do not listen to a nurse on the internet for true medical advice. This is not medical advice. I'm just generally speaking. Please talk to the doctor. If you didn't know, it says 7 days started dialysis. They told me his GFR is still 7 and won't get any better. I'm not sure if you're saying like, what does that mean or what you're asking, but I would ask them what that means and ask them, what should I do? Thank you, Happier Ever After. Thank you, Sally. I'm sorry I couldn't help you with your GFR question more. Thanks, Mark. I won't be. Hey, everybody. PS, we still have 15 minutes left, 3:14. So the last 5 minutes I'm going to do these big talk questions, but how's everyone doing out there? Thank you for joining the live. I try to go live every Thursday at 5. You guys are great. We have a wonderful community here. Everyone supports each other. Oh my gosh, my favorite songs. This is crazy that no one. I'm not. I wouldn't say I'm not crazy about music, but I'm not someone who like follows music and like has favorite songs. I listen to a lot of podcasts. I talk to a lot of people on the phone when I'm driving in the car. I go through periods of time where I listen to the same song over and over and over again. Um, who's the girl that sings? Pink Pony Club. Pink Pony Club. She's like young and cool. What's her name? I love that song. You guys, I think I'm literally having a hot flash. I think you guys are experiencing me have a hot flash as we speak. I am like, this is what a hot flash is, right? Where you just like start getting hot. Oh my God, it's like I'm burning alive. For anyone who's never mind, I'm not going to make a hell joke. Lisa, I'm reading your question right now. My 74-year-old mom has been on hospice for 9 months now. She's at home, bedridden with MS, multiple bed sores. Her urine is dark. Her doctor wanted her to go to the hospital to get. Sorry, I don't see your question. Chapel Roan. Thank you. Chapel Roan. I do like Chapel Roan. When people die unexpectedly in their sleep, what's going on? It could be tons of different things going on. There are so many different things that could be going on that make you die in your sleep. You could have a PE, you could have a stroke, you could have a heart attack. You could just be old and like there's cardiovascular things going on. I would love to die in my sleep when I'm old. I just knocked on wood. That's why I did that. That's what you're hearing. Hello? No, I'm just kidding. You guys remember, I'm sitting here by myself in my apartment, like entertaining myself. I'm 64 and like Pitbull, Mr. Worldwide, or whatever it's called. Listen, I'm a Pitbull girl. When Pitbull was really cool, was in my like party days. Thank you, Paige. Okay, let's see. Susan from New Jersey. Hi, Julie and chat. Is there a way to get end of life access in New Jersey? At this time, you must be terminal. I've been chronically ill for 30 years. Susan, unfortunately, I don't think, no, you have to be terminally ill. It cannot be a chronic illness. You have to be terminally ill with less than 6 months to live, unfortunately. Are there any signs someone might die in a year? specific diseases, you can kind of know you'll die in a year. Certain types of pancreatic cancer usually, sometimes metastatic cancers, not all the time though, but sometimes. Age, if you are not eating and drinking like barely at all and have like dementia or something, and you are like barely eating and drinking, I'm talking like spoonfuls a day, sleeping 22 hours a day, probably would be the sign. Thank you for everyone supporting me about the hormones. That's what I think is happening right now. You guys see my face. It's like getting dewy. It's okay. I'm okay with it. Yeah, in Canada you can be chronically ill and get it, but not in Jersey. KS, first time live. Yoo-hoo! Welcome. I'd like to know your experience on the dying person that has a narcissistic kind of personality. Oh, are they scared, stubborn? I've always wondered. Okay, anyone dying with that's like, okay, people die how they lived. I always feel so heartless. I always feel heartless and like I sound heartless saying this, but I have dealt with people who are dying who are, maybe they're a narcissist, maybe they're a sociopath, maybe they have a personality disorder. I would give them good care still. I'm not going to like make them suffer, but they are still who they are. They are still who they are. And if you have caregivers who are like that, even more chills down my spine. There was a person I had to call Adult Protective Services on several times and get the person removed from the home because of the caregiver. And the caregiver was, I mean, I can't, of course, clinically diagnose anybody, but like narcissistic in every way. It was like literally bone chilling to be around them. Bone chilling. Ugh. Bone chilling. Thinking about stuff. I had to put boundaries in place over and over again. She spoke to people she employed horrifically. She denied her husband medication because she said he was doing it purposely. He's just doing that purposely. He's not. And I was like, something's wrong with this lady. Something's wrong. Something's wrong here. It was very crazy. My suggestion for anyone dealing with that is to keep boundaries best you can. Keep boundaries best you can. Get help from outside resources, meaning therapists, counselors, the hospice company. If it's like your parent on hospice, like you don't have to be there if you don't want to. You do not. Welcome everybody. Thank you for everyone answering each other in the chat. You guys are so wonderful. Welcome to perimenopause. Exactly. And I think you guys knew that I was having like migraines and stuff. I think that's what's going on too. I think it's all I'll never die. I'm Superman. Good luck. Good luck. Good luck, Sammy. You're in the right place. Just kidding. Yeah. Okay, you guys, listen, we have like a few minutes left and I want to hear from you guys because all of you guys here I feel like are kind of people who have been here kind of from the start and you guys are always so great. So let's do a big talk question. Okay. I'm just going to pick one and we're going to just play along. Okay. Thank you for everyone talking about hormones in the question in the chat. Oh wow, okay. This might be a tough one for everyone to answer, but try to. What does success mean to you? What does success mean to you? And I want everyone to you don't have to answer it, but answer it if you think about it. Just think about it. What does success mean to you? I know it means to me, but I want to hear everybody else first, and then I'll go. How long can you survive if your hemoglobin is low? It depends on how low it is, Lisa. Do you know how low it is? Quite some time, by the way, but you'll have symptoms. You'll be short of breath mostly. Sally says peace of mind. Alex says, to me, success means opposite of failure. Success, Callie. Am I saying it right? Callie, success means joyful in life. Bing says, having loved well, living a happy life. Success equals dying without regrets. I'm a registered nurse thinking about going into hospice. Paige, my advice for you is just do it. You don't have to look into anything. You don't have to do anything. Just do it. I mean it. That's what I did. Nicole, I'm going to get to that question in a second. Look at all these things. Is everyone reading this? Enjoying your life, leaving the world better than you found it. Accomplishments. Success is not having hot flashes. Passive income. Okay, this is everyone. Yeah, that's my success to me means peace of mind, like peace of mind in the day that I'm in. Peace of mind that in a day that I'm in, and like feeling connected to myself and to my higher power. And my higher power is very general, by the way. My higher power doesn't exclude anybody, doesn't not love anyone, doesn't accept so just so you know, I have a very inclusive higher power that I really try to stay connected to at all times. And that gives me peace of mind and makes me a better person. Okay, let's get to Nicole's question really quick, and then we're going to do a couple more of these. Thank you for everyone like joining in. I feel like it really helps us as a group. Makes me feel warm and fuzzy inside. And I'm already hot, but a good warm and fuzzy. Am I like screaming at you guys? I'm sorry. How is pregnancy dealt with on hospice? If an expectant mother is in for years and found out she had ovarian cancer, she got pregnant, what would happen if she chose hospice? Oh, Lord. I think she'd be okay, because if she was on hospice, she couldn't get treatment for ovarian cancer, but she could still go into hospital for pregnancy because the pregnancy is not part of her terminal diagnosis. So, yeah. Shoot, Lisa, I did not see. I would have to know what the hemoglobin was, Lisa, to know how low it was. But people can live quite a long time with low hemoglobin. You just usually have shortness of breath. But she refused. How long can you survive? Yeah, I have to know what the hemoglobin is, Lisa. I'm sorry if you've already said it and I don't see it. Yes, I've definitely taken care of patients with Lou Gehrig disease, which is ALS. I feel like it's a sad one. What would happen to the baby? Oh, I mean, the person couldn't really get, if you were pregnant and you had ovarian cancer, they couldn't receive treatment. Baby, I think should be okay, but probably would be, I'm not, you know what? I shouldn't even try to answer this. I should know better. I don't know. I don't know. Good nurses or good healthcare workers say they don't know when they don't know. I was going to sit here and try to, it wasn't like I was going to lie, but I was going to tell you what I thought. But really, I know nothing about babies and like how they grow and how, I mean, I generally know how they grow in the womb and like things like that, but I don't really know. So I should not answer that. I should not answer that, Nicole. That's a great question. That's a great question that maybe I can look up the answer at ChatGPT. Okay, 2 minutes. 2 minutes. One last question for all of you guys. Oh, I like this one. I like this one. Does that sound like ASMR? I like this one. Okay, ready? What is your number one priority today? Leanne, this is a good one for you, who says I've been beating myself up. I have a feeling I know why, because it's usually the same reason why a lot of people are in here, beat themselves up. But what is your number one priority today? What is your number one priority today? Don't drink, love. Seth says self-care. Magna says sleeping because it's almost 4 a.m. Amy says, number one today was my health, self-care, practice my piano, taking care of myself. The headaches stop after menopause. Thank you, Charlotte. Number one, being there for my mom and dad. Health, brush my teeth. That's right, Julie. Brush those teeth. You guys are the best. I'm like loving this. Receiving God's love and mercy. Oh, T King, I love it. To learn and forgive myself more. Yes. Telling my family I love them. Being kind. Don't know what others are dealing with. That's right. Tori, therapy. I go to therapy every Tuesday. Whoop, whoop. Jennifer, we missed you too. Victoria says family. Good vibe says positive thinking, spreading love, sharing my love for God. I love that. Making sure my husband's pain free from his kidney stone. Oh, I'll be saying prayers for him. Kidney stones are hard. Forgiveness of myself. David C says, and join Hospice Nurse live show. That's right. Jim John says, adulting, mission accomplished. Okay, what's mine? My number one priority today was to stay sober and to help another alcoholic. And I did. And I did earlier today. And I stayed sober so far. If you're allergic to morphine, don't worry. There are so many other things we can help you with. We will find what works for you. Your channel is the antidote to doom scrolling. Karen, that's literally the sweetest thing I've ever heard. Thank you. You guys, I'm literally sweating. My legs are sweating. Everything is sweating. Actually, can you see? That is sweat. Listen, you guys, we're getting closer on here than you ever could have imagined. Huh? Going through hot flashes together, going through breakups, listening to each other. Okay. Hold on, Suzanne. You answered my question as why my dog was struggling when she was dying. She died 4 days ago. Oh, Suzanne, I'm so sorry. Thank you for being here. Go put a t-shirt on and shorts. I know. Listen, there was a camera. It was live. So I didn't want to like leave and go change. There's no reason for me. I just like tortured myself through the hot flash. It was kind of funny. It's kind of funny. Anyway, guys, I love you. Today was so fun for me. So I hope it was, I mean, fun's a weird word, right? But you know what I mean. Fun talking about death and dying. I don't know. I really appreciate this group. Thank you everyone who joined. My book, my journal is available now to you if you want it. That chair that I talked to you about, go to my last video. Look at the ad. There's an ad for a really expensive chair that is only $350 now. And with my little code, it's only $300. This is not an ad. This is me being like, you won't regret it. It's amazing. And it's $300 is like 1/3 of the price. So the link is in the description of my last video where I talk about like a peaceful death and talk about end stage kidney disease. You can also go to my Instagram, Hospice Nurse Julie. It's in my stories. Anyway, you guys are the best. Thank you so much. What else can I tell you? I think that's it. All right. Love you guys. Have a beautiful night, day, week, weekend, and I'll talk to you later. Mwah.